Have you ever wondered what all the fuss is about with flossing? Or are you curious about whether anything bad would happen if you just stopped flossing? Do you want to know more about how your oral health contributes to your overall health? All of this and more on today's episode of The Secret Life of Numbers.
Welcome to the Secret Life of Numbers podcast, the podcast where we dissect everyday numbers and statistics to find the stories behind them.
Each episode, we take a number or statistic and break it down. We will tell you where it comes from and what it means for you. Along the way, hopefully we will inspire you to think about the numbers in your own life.
I'm Levannia, your data scientist on call. I'll be breaking down the numbers.
I'm Lindsay, your data translator. For when Levannia gets too technical on us, I'll be breaking down the rest.
All right, let's jump in.
So, Levannia, today is a very exciting episode.
It is. It's the last one in our mini-series.
Yes. So, as you said, this is our third and final episode of our oral hygiene and dentistry mini-series. We started out this mini-series talking about whether or not 4 to 5 dentists really recommend Colgate, and did a breakdown of different sampling techniques and data manipulation. We then moved on to why we brush our teeth for 2 minutes twice a day and gave an overview of different levels of evidence. Today, we are finishing off the mini-series by talking about why we floss once a day. What's the fuss? Would our dentist really notice if we stopped? How does the evidence for flossing compare to toothbrushing? All very important questions.
Agreed.
But before we get started, I believe both of us are pretty diehard flossers.
I am. I have a specific brand of floss I like. I do it every night before bed. I just like how it makes my teeth feel right before bed.
I agree. I think if I don't floss, I do notice. But also, my mom is a dentist. So growing up as a kid, not flossing wasn't an option.
Yes, I remember when I came over to visit you once, I made sure that I brought my floss and my toothbrush and put them in view in the bathroom so that she knew. She knew that I knew.
There was never any question. I feel like dentists have this sixth sense where they can just look at your mouth and they can tell whether it's going on or it's not.
Yeah, whether you've been flossing. Let's get started on some of the numbers about flossing once a day.
Yeah, so where does the literature stand on flossing once a day?
So flossing, it seems, is a pretty debated topic. And in fact, over the last decade, there was a fierce debate among public and consumer press about whether flossing has any benefit on oral health, because the U.S. Department of Health and Human Services and the U.S. Department of Agriculture in 2015 removed the recommendation of flossing from their dietary guidelines.
Okay, so U.S. Department of Health, I'm not totally sure what they cover, but at least it's health. But why are we taking recommendations from the U.S. Department of Agriculture on oral hygiene?
Well, what do the dentists say, Lindsay?
The dentists say floss once a day. And to be sure of this, I consulted both my mom and then also, the regulatory bodies. So I looked at the Canadian Dental Association, and they're pretty clear about the fact that we should all be brushing our teeth twice a day and flossing once a day. And this isn't just some conspiracy theory so that they sell more floss. Part of the reason that it's so important to be flossing every day is that if you caught our toothbrushing episode, we talked a bit about plaque formation. And basically, plaque is a sticky film that's always forming on your teeth. And if you're not removing your plaque within 24 to 36 hours from when it forms, it hardens into tartar, or what is also called calculus, not the math. And it will have to be removed by professional cleaning. So it's really important that we're keeping up with this.
I guess, what is flossing first before we get into some of the numbers bit?
It's almost an existential question. What is flossing? So flossing is really an important part of the whole picture of your oral hygiene. So I think most people know that it's really important to brush your teeth regularly, and you can really feel the difference. But flossing is essentially accomplishing the same thing that brushing is, just in different parts of your teeth. Flossing is really important for interdental cleaning. Inter meaning in between, dental meaning teeth. It's important to get in between your teeth and around your gum line with your floss to, as you do with your toothbrush, get rid of plaque, debris, keep it clean, and really you're reaching all those places where your toothbrush can't.
I did look at a systematic review. Just as a refresher, a systematic review is defined as a review of the evidence on a clearly formulated question that uses systematic and explicit methods to identify, select, and critically appraise relevant primary research and to extract and analyze data from the studies that are included in the review. And then these methods obviously used must be reproducible and transparent. And in particular, because there have been a lot of updates in this field of flossing, maybe because we're still debating it, but the most recent one, which was titled Home Use of Interdental Cleaning Devices, in addition to toothbrushing for preventing and controlling periodontal diseases and dental caries, they were asking the question, how effective are home use interdental cleaning devices plus toothbrushing compared with toothbrushing only or use of another device for preventing and controlling periodontal gum disease, tooth decay, and plaque?
Okay, so interdental cleaning device, I'm imagining they're talking about floss or those flossing picks.
Yeah, they were looking at floss sticks, those types of things. But they looked at 35 trials, and of those 35 trials, 15 of them were related to floss.
Okay.
And in their selection criteria, they used randomized controlled trials that compared toothbrushing and a home use interdental cleaning device versus toothbrushing alone or with another device for a minimum duration of 4 weeks.
Right. So what do they find?
So what they found is that using floss in addition to toothbrushing may reduce gingivitis in the short and medium term. It is unclear if it removes plaque. They also said that using an interdental brush in addition to a toothbrush may reduce gingivitis and plaque in the short term.
So it's not as strong as I was thinking would come out of randomized controlled trials in a systematic review.
Yeah, it's not as strong as I expected either. And I think part of that might be because flossing is very technique-based.
Yeah, I think maybe even more so than brushing.
Yeah, because I did find another paper in the Journal of Dental Research, and there they performed professional flossing. So flossing by dental hygienists was performed on school days for 1.7 years on predominantly primary teeth in children. And they found that they had less risk of caries.
Right, which is the fancy term for cavities.
Exactly. So I think there might be a bit of technique associated with it. And also, it's very hard to just analyze floss on its own because you're always flossing in conjunction with something else. Like you're brushing your teeth and flossing.
And it wouldn't really be ethical to ask people not to brush their teeth so that you could do this study on flossing. I think you'd be hard-pressed to find like a research group in oral hygiene or a dentist to run this study where they're like, yeah, I think it would be a really good idea if half the people stop brushing their teeth. Yeah. I suppose, too, coming back to the systematic review, it was specifically looking for a minimum duration of 4 weeks. So that's probably why there's all those qualifiers of in the short term in their results, because they weren't looking at longer.
Yes. And really, there aren't very many studies for like long-term flossing use that I was able to find.
Right. But one of them would have been that professional flossing with the children. That one was very positive for flossing.
They did list that in the systematic review that there might be some performance bias because all the participants in the studies were not blinded. Like they all knew they were flossing, for example.
Yeah, I mean, you are just going to anesthetize people and be like, did we floss? Did we not floss? Like, yeah, how do you blind that?
Yeah, so I guess in that sense, like maybe if they know they're in a study, they might floss more or they might floss to like stricter, I guess, rules than if they weren't in a study. But that could be one of the biases in the systematic review. But as you mentioned also that from this review, we can't really get any ideas about long-term effects.
Interesting. If people listen to our toothbrushing episode, it's not as maybe well supported in the literature with lots of systematic reviews as fluoride in toothpaste, for example.
Yeah, exactly. A lot of these reviews say that there is benefit to flossing and brushing your teeth, to coupling them, but the amount of benefit isn't unclear.
Right. And we talked about some of the confounders, like the length of study, whether blinding is possible in a study, and technique, which is huge with flossing. Like, even myself, a child of a dentist, I am still working on my technique.
Oh, yeah. Every time I go to the dentist, they're like, do you floss? And I know that question really means you're not flossing well enough.
They ask the question, but they already know the answer.
Yes. So we've talked a little bit about flossing, and we've looked at a systematic review that discussed the benefits of flossing. After the break, Lindsay's going to come back and tell us what's the deal with flossing? Like, what's the fuss?
Welcome back, everyone. So before the break, we looked at a systematic review all about flossing and discussed some of the reasons why we may not be seeing as strong of evidence for flossing in the literature as we did for toothbrushing. But now it's time to talk about what is the fuss with flossing, right? If the literature still seems a little gray and the Department of Agriculture says we don't have to, why are we flossing?
Yes.
I think the long and short of it is kind of what we've talked about. Like, it's important to get those nooks and crannies that you can't get with your toothbrush. And so brushing and flossing are really on the same team. They're synergistic and they work together to help you maintain your oral health. Something you might be wondering is, what's the big deal? What happens if I stop flossing? Or what happens if my technique is subpar for a long period of time? Well, there's a few different consequences. Early on, here comes gingivitis.
First step or first visitor.
So gingivitis is really an inflammation of your gums. And there could be some redness. For the most part, it can be asymptomatic. And it's due to this really accumulation of plaque over time. One of the great things about gingivitis is that in general, it's caused by poor oral hygiene and it's reversible. You can fix your technique, you can get in that routine, and you can reverse gingivitis because there's no permanent bone loss or changes to your dental structure. But gingivitis has a cousin, and it's named periodontal disease or periodontitis. Periodontitis is the next level. So it's essentially a chronic inflammatory disease, and as it progresses, it starts to destroy the gums and the underlying structures supporting your teeth, leading to these, what we call gingival pockets that deepen in your tooth, and there's actually bone loss. An example of some of the microbes that enjoy living in those little pockets is Porphyromonas gingivalis, which we will come back to later, so keep that name in mind.
It just rolls off the tongue, of course.
So one of the things that we talked about in our toothbrushing episode is how microbes set up little cities and skyscrapers on your teeth. So the microbes start to set up little cities and skyscrapers in your gingival pockets.
Oh, no.
And this leads to more inflammation, and there can be a recruitment of immune cells, and then we have this whole cascade of inflammation.
So it's a slippery slope, really. Like, once gingivitis visits you, like, if you don't clear out that house guest, you don't want it to invite its cousin.
Exactly, because it's like when you have a house party and you invite one group of people, and then that group of people invites all these people that you didn't want to come to your house party. And you're like, what the heck? How do I get them to leave? And the thing with periodontitis is because there is changes to the architecture of your teeth become loose and they can actually fall out.
Oh, no.
Yeah. If you like having teeth and you want to keep your teeth,
floss the ones that you want to keep.
Yes. Only brush and floss the ones you want to keep. And I think it's safe to say that flossing does help combat that gingivitis. It helps prevent that progression of gingivitis to periodontitis, because if you're flossing correctly, you're targeting those susceptible spots right at the gum line, and then you're also brushing gently in those areas, not too hard so that you don't get recession of your gums, which is where your gums kind of start to move up. Not good either. So you might be wondering, okay, periodontitis, what's the big deal? We just keep leveling up here. So one of the things that's really incredible, and I dove deep into the literature on this topic, is that periodontitis has an incredible amount of systemic links to your health. So what's going on in your mouth is related to all sorts of different processes in your body.
All right.
Do you have any ideas of what some of these links might be?
Well, I did read an article a couple years ago that plaque, like in your mouth, could be related to Alzheimer's because it's the plaque that forms on your brain is very similar.
You hit the nail on the head.
Actually, I think it was you who told me that.
I remember sitting in one of my microbiology classes in undergrad, and we were talking about this really recent research. And I was so excited because I was like, oh my gosh, my mom, she's preventing Alzheimer's.
She's saving lives, really.
Yes, it's a beautiful day to save lives. We're going to talk a lot about the link or potential link between Alzheimer's and periodontitis, but it's not just Alzheimer's. So I found so many examples. There's links between periodontitis and cardiovascular disease, type 2 diabetes, preterm birth, low birth weight, preeclampsia.
What's preeclampsia?
So preeclampsia is essentially high blood pressure during pregnancy, and it carries with it a lot of different risks. So it's very important to identify and deal with.
Okay.
And there's even more. So some studies have proposed that the microorganisms in your mouth are really the canary in the coal mine, so to speak, for systemic diseases. There's also links between pancreatic cancer and microbes in your mouth, pediatric Crohn's disease and microbes in your mouth, heart disease, all sorts of things.
Huh. I had no idea.
Me neither. It's this whole world, especially because the way that medicine and dentistry is structured is they're both healthcare professions. They're both doctorates in terms of the education that you need, but they're at an arm's length, right? Like in Canada.
Yeah, they're separate camps.
Yeah, like in Canada, we have universal healthcare. So if you have, I don't know, if you break your leg and you go to the emergency room, it's free. But if you break your tooth and you have to go see a dentist for an emergency, hopefully you have insurance. One of the things that's really interesting is there are all these links between oral hygiene and dentistry and the rest of your health. So it's important to take care of both.
Agreed.
As you mentioned, the link between Alzheimer's disease and periodontitis is kind of sexy science. It's a very active area of research, and I'll take us through some of the recent research. So remember that microbe that I talked about, Porphyromonas gingivalis?
I remembered it, but I didn't remember how to pronounce it.
By the end of this episode, we will all be pros. Really at the center of this research is Porphyromonas gingivalis, and it's been found in the brains of people with Alzheimer's disease. And one thing that's really interesting about this microbe is it releases this protease, which is an enzyme that degrades proteins, so breaks them down. And it's called gingipane because it is a pain to have. And it's also been found in higher levels in brains of patients with Alzheimer's disease. Gingipane is what we call, for a microorganism, a virulence factor, which we can think of as kind of a little mini microbe tool or a microbe superpower because it helps the microbe accomplish what it's set out to accomplish. So gingipane is part of what helps Porphyromonas gingivalis reach different areas of the body, set up shop, do all those things.
Build its skyscrapers.
Exactly. You know, early construction sites. One study in particular was looking at gingipanes in the brains of patients with confirmed Alzheimer's disease, as well as the brains of people who were starting to show pathological signs of Alzheimer's disease. Not clinical ones, but in their brain, they were starting to see those hallmark signs of different plaque formation, but they weren't yet diagnosed with Alzheimer's disease. And they found that gingipane was present in both brains. A lot of the research up until this study was very correlation, right? We're finding this, but we don't know if it's the smoking gun of, is this what is leading to that progression of Alzheimer's, or is this a contributor?
Yeah, you don't know if it's correlation or causation.
Exactly. But what this study found is because it was in people who weren't yet diagnosed, it could be a precursor rather than a consequence. One of the reasons for kind of a strong belief in the correlation between the two is that when you develop Alzheimer's disease, functions slowly regress, right? So people can have a lot harder time remembering to brush their teeth or floss their teeth or keep up with their oral hygiene.
Yes.
So there's kind of a chicken and the egg thing there of, is it a consequence of the disease or is it a precursor? And this study is kind of one of the ones suggesting that it could be a precursor, but we still don't know. So there's lots of different mechanisms that have been proposed. There's lots of different research finding this association, but it's still an active area of research to say, is this the smoking gun of Alzheimer's disease? We don't know yet, but it's something that I'm excited to see more research in the future.
So, Lindsay, we've talked a lot about the bad bacteria in your mouth and like the scary ones. But are there good bacteria in your mouth? Like, is there a good mouth microbiome?
Yes, absolutely. 1,000 times. Yes. So we've mentioned this in several episodes, but there's this wonderful book called The Whole Body Microbiome, and I revisited the oral microbiome chapter.
I feel like by the time we get through this season, you'll have talked about all of the chapters.
Yes. So in case you missed it, in our 99.9% of germs episode, we talked about the skin microbiome. And then last week in toothbrushing, we talked about the oral microbiome, but more from a bad bacteria.
Yeah, from the villain's point of view.
So here from the protagonist side, let's talk about the good bacteria in your microbiome. So a lot of the mechanisms that we see in different areas of the body for how the good microbes protect us are kind of universal. So similar to skin, they help prevent colonization or bad bacteria setting up shop in your mouth because they're taking over those surfaces and hanging out there. And then they also help with your immune system maturing and developing and learning to recognize self and non-self, as well as pathogen and not pathogen. And particularly in the mouth, they help keep the mouth at a good pH. So as we mentioned in our toothbrushing episode, sugar doesn't cause cavities. The microbes that eat the sugar and create acidic waste products do. So there are microbes that consume sugar and then release basic waste products, so the opposite of acidic. And then that helps prevent that acidic shift that contributes to cavity formation.
I see. So they're like battling the bad bacteria in your mouth.
Yes, they're taking care of you.
All right. Time for the cheesiest part of our podcast, the science seed. Each episode, we like to give our listeners something to think about, a science nugget to help you think more critically about the numbers, statistics, and really the science you hear every day. Today, we had an overview of the science behind flossing. And although we don't have a ton of studies that are as adequately powered as those behind fluoride toothpaste, for example, you'll be hard-pressed to find a dentist that doesn't recommend flossing once a day. So for today's science seed, we want to talk about the difference between clinical and statistical significance.
Let's start out with some definitions.
Yes, take it away.
Okay, so starting out with statistical significance. This is really defined as the reliability of the results that you get from a study.
Yes, so that's the significance that we're looking at in those systematic reviews.
Exactly. So it's really that property of the research that is being conducted. And when we talk about statistical significance, we can't not talk about p-values.
The dreaded p-value. When we conduct a study, we usually have a p-value. And you usually see that you want this p-value to be below a certain threshold, usually 0.05. And what the p-value says, or what that p-value number is it's the probability that the results are due to chance rather than an actual difference in the treatment or what is being studied between the groups. So p-value of less than 0.05 means that the probability that that difference is due to chance is very low.
Yeah, it means it's less than 5%.
Exactly, yeah.
One of the things that's really important is that a p-value is really, in part, a property of the studies being conducted. So if you don't have an adequate sample size, you might not be able to get a significant result, even if the intervention is effective.
It's a symptom of the study itself. or it's based on the way the study is built itself. You can be confident in significance, or you can feel that there is a difference, but if you didn't perform the study correctly, you won't see a difference in the groups.
And this is where we kind of come into clinical significance. And this is really the practical importance of a treatment. So there might not be statistically significant studies backing up an intervention, but there might be clinical significance in performing that intervention. And we could kind of think about flossing in that sense. Clinically, flossing is seen as very important and is recommended by dentists, by the different associations, but it might not have the best studies backing it up.
Yeah, and that just could be a symptom of the adequacy of those studies that have been occurring.
Yes. And if we want to kind of have another example, because there's lots of different examples where clinical versus statistical significance are not on the same page. An example could be that there's a new cancer drug, and when studied, there's a statistically significant difference in life expectancy. Sounds perfect, right? Why would you not?
Yeah, that sounds promising.
Well, what if the difference in survival between the treatment and the control group was only a few days?
So that's not really clinically relevant.
Yeah, exactly. There's a lot of considerations with that. Like, for example, too, this drug might have a lot of side effects. So is it worth keeping people alive for a few more days when they're sick with side effects? And it's kind of a cost-benefit analysis, too. So there's a lot of different reasons why a study might not have a statistically significant result, but that doesn't necessarily mean that what's being studied isn't clinically significant, and vice versa.
Thanks for listening, everyone. You can find us on Apple Podcasts, Spotify, Google Play, or wherever you find your podcasts. You can find the references we use for this episode in our show notes. A special thank you to Julian Bertino, who does our sound editing and music.
Have an idea for what number we should cover next? Want to learn more about what we talked about today? Follow us on Instagram at The Secret Life of Numbers.
We'll catch you next time on The Secret Life of Numbers, where the numbers can run,
but they can't hide.